Usually when we talk about a medical diagnosis, there's this expectation of precision, like engineering almost.
Right. Yeah, like it's completely binary.
Exactly. You break your arm, the x-ray shows that jagged white line, and the doctor just points and says, yep, there it is. There's the problem.
It gives us this sense of control, broken or not broken. We like things to be visible and easily categorized.
Yeah, but then you step into the world of women's intimate health, specifically chronic intimate pain, and suddenly that x-ray machine is just, it's useless.
It really is. It is the absolute definition of diagnostic muddy waters.
Right.
Especially when we are dealing with conditions that just, they don't show up on a standard scan, but they can absolutely devastate a person's quality of life and, frankly, their most intimate relationships.
Well, welcome to this custom-tailored deep dive. We are so glad you could join us today.
Definitely. We've got a really fascinating mission for this dive.
We really do. We are unpacking a massive stack of complex medical journals, clinical studies, and intimate health clinic FAQs to explore a highly specific, cutting-edge biological mechanism.
Yeah, we are looking at how a very unique biological tool is being used to restore mucosal elasticity at the vaginal introitus.
Right, the vaginal opening. And ultimately, the goal is to understand how this alleviates the sharp, friction-induced pain of entry-dyspareunia.
And I have to say, it is a phenomenal blend of information today. We're looking at real-world clinical trial data, incredibly granular biochemistry regarding tissue repair.
Down to the cellular level, yeah.
Exactly. Plus very practical day-to-day insights from osteopathic and women's health clinics.
It's a lot to cover. And before we get into the weeds, I have to tease the unexpected hero of today's deep dive, because here's where it gets really interesting. The solution we're exploring today actually involves extracting DNA from marine life.
Which is wild.
Right, specifically the gonads of male salmon trout.
Yep.
Yes, fish DNA is currently providing a non-hormonal, non-surgical lifeline for women experiencing profound intimate pain.
It sounds completely like science fiction.
It really does.
But the biochemistry behind how that marine DNA interfaces with human tissue is it's remarkably elegant.
I can't wait to get into that. But if we want to understand how fish DNA fixes the problem, we first have to map out the architecture of the pain itself.
Right, start at the root.
Yeah. So let's start at the beginning. What exactly is happening at the vaginal entry point when the body's natural tissues begin to fail?
Well, the clinical umbrella term we are focusing on here is dyspareunia, which broadly speaking means persistent or recurrent pain during sexual intercourse.
Okay.
But we have to be really careful to distinguish between different types of dyspareunia because there is deep pelvic pain, right? That might happen during deep penetration.
Right, and that's usually other stuff like endometriosis or...
Exactly. Endometriosis, pelvic floor hypertonicity, or even internal scar tissue.
Got it.
But today, we are hyper-focused on superficial entry pain. This is the sharp pain right at the vaginal introitus, or the physical opening.
And it's crucial to note for you listening, this isn't just a psychological issue. I feel like there's a lingering myth out there that this kind of pain is just, in your head or entirely related to arousal.
Oh, absolutely. That myth is so damaging.
It is. But the clinical data shows this is a profound, literal, mechanical, and structural collapse of the tissue.
Yeah, it is a physical failure of the biological barrier, which of course raises an important question: what drives that collapse in the first place?
Right. Why does it happen?
The primary culprit, especially in peri- and postmenopausal women, is a precipitous drop in systemic estrogen.
Just a total cliff dive.
Exactly. We are talking about estradiol levels plummeting from premenopausal peaks of around 800 picograms per milliliter all the way down to below 30.
Wow. Below 30, that is a staggering drop. Estrogen is basically the fuel for this entire ecosystem, right?
It is. It's the master regulator for vulvovaginal cell growth, blood flow, barrier function, all of it. So when that estrogen disappears, the tissue undergoes profound atrophy.
So what does that actually look like?
Well, if you look at it under a microscope, you can see the epithelial surfaces literally flatten out. They lose their protective keratinization, and they lose these little projections called papillae.
Wait, before we go deeper, what exactly are papillae and keratinization? Are papillae like microscopic shock absorbers for the tissue?
That's actually a brilliant way to picture it. Papillae are these tiny finger-like projections that interlock the top layer of tissue with the layers underneath.
Oh, okay, so it holds it together.
Right, it gives it grip and structural stability against friction, and keratinization is essentially the body's way of toughening up a surface layer of cells.
Kind of like a callus.
Sort of, yeah. Like how the skin on your hands is tougher than the inside of your cheek. When estrogen leaves, both of those protective mechanisms they vanish.
Okay, so the surface loses its armor and its shock absorbers.
Yeah.
What happens to the tissue underneath that surface?
The connective tissue beneath takes a massive hit. The collagen and elastin fibers in the lamina propria, which is the layer right under the surface.
Yes, the dense foundational layer just beneath the surface, those fibers become heavily depleted. And because of this, the tissue completely loses its natural elasticity.
Wow.
Yeah, the vaginal rugae, which are the natural folds that allow the canal to expand and stretch like an accordion, they simply flatten out.
Okay, let's unpack this. If you've ever dealt with this, it feels like the vaginal introitus goes from acting like a thick, resilient, well-lubricated sponge that can easily adapt to movement to something more like, I don't know, dry, fragile tissue paper that tears under the slightest pressure.
That analogy captures the physical reality perfectly. The tissue becomes so thin and structurally compromised that what should be normal, painless friction causes actual micro-trauma.
Right, tiny tears.
Exactly. This leads to bleeding, ulceration, and what clinicians call superficial petechiae.
Petechiae. Yeah, which are these tiny, highly sensitive blood spots that form right under the surface of the skin.
Oh, it sounds excruciating. And the chemical environment changes too, right? It's not just a physical thinning.
Whoa, the chemistry radically shifts. Without estrogen, the local population of protective lactobacilli bacteria starves and decreases.
The good bacteria.
Right. And without them, the vaginal pH rises from its healthy acidic state to a much more alkaline environment.
And alkalinity is bad news there.
Very bad. That elevated pH not only causes chronic irritation and burning, but it leaves the tissue incredibly vulnerable to pathogenic infections.
So if a woman is dealing with this, she is facing a complete structural and chemical breakdown.
Exactly.
Now, traditionally, the standard medical fixes for this are hormone replacement therapy, HRT, or energy-based treatments like vaginal lasers.
Right. Those are the go-to options.
Those aren't universally viable options for everyone. I mean, many women simply cannot take hormones, such as breast cancer survivors, or they want to avoid the high costs and potential pain of laser treatments.
Or they might be younger women experiencing this atrophy due to certain types of birth control or even breastfeeding. The demand for a non-hormonal, non-surgical alternative that actually rebuilds tissue is massive.
So, if hormones are off the table and lasers are too expensive, a woman is essentially stuck with a mechanical tissue failure and, well, no tools to fix it. So how do we rebuild that sponge without using hormones?
We have to find a way to give the local cells the right signals and the right raw materials directly, completely bypassing the need for systemic estrogen entirely.
Which brings us back to that wild hook from the beginning. The solution researchers have landed on is literally extracting DNA from fish.
Yes. Specifically, we are talking about polynucleotides, or PNs.
Okay.
These are natural, biologically active biopolymers. They're highly purified chains of DNA extracted from the gonads of male salmon trout.
But wait, I have to push back on this. You're talking about putting raw genetic code from a marine animal into a highly permeable, already fragile human mucosal tissue.
I know how it sounds.
Like, how can we be absolutely sure it doesn't trigger some massive immune rejection or, worse, somehow alter human genetics?
It is the most common concern, and it's entirely valid. But the science here is very reassuring. First, these PNs undergo incredibly advanced purification and high-temperature sterilization.
Okay, so it's heavily processed.
Heavily. This process strips away all the proteins and peptides that would typically trigger an immune or allergic response. What you are left with is just the raw chains of nucleotides.
And nucleotides are just the base materials, like the basic chemistry.
Exactly. Nucleotides are the universal building blocks of all DNA and RNA across almost all living things on Earth.
Oh, wow.
Because they are highly purified fragments, they do not carry any readable genetic information. They cannot alter human DNA.
That's a huge relief.
Right. They act strictly as raw construction materials and cellular signaling molecules. And because they are so fundamental, they are extremely biocompatible.
So they aren't an instruction manual trying to reprogram the body. They are just a massive delivery of bricks and mortar.
That's it, just bricks. And the medical community knows they are safe because PNs have a rich history. They have been used for decades in dermatology and advanced wound healing.
Like morphine.
Yeah, we are talking about repairing severe skin grafts, treating diabetic foot ulcers, deep dermal biorevitalization. They have a long proven track record of safely restructuring human connective tissue.
And now, that same regenerative power is being brought to the vulvovaginal area. Researchers are delivering these PNs via daily vaginal ovules, topical creams, or even specialized intradermal injectables administered by a clinician, right?
Yes, the delivery method usually depends on the severity of the atrophy and also whether the primary issue is the external vulva or the internal vaginal canal.
Okay, I understand the theory, but let's talk about the practical application.
Hmm?
If I apply a PN ovule or a cream, is it just acting like a fancy, highly engineered moisturizer? I mean, structurally, how is this any different from an over-the-counter water-based lubricant I could buy at the pharmacy?
That is the critical distinction we need to make because what's fascinating here is the immediate physical and chemical transformation that happens the moment those high molecular weight PNs hit the mucosal tissue.
Okay, what happened?
They do not just sit passively on the surface like a lubricant. Because they are highly hydrophilic, meaning they obsessively attract and bind to water, they actually reorganize themselves into a three-dimensional gel.
A 3D gel, like a microscopic scaffold.
Precisely. They form a robust, microscopic 3D matrix that traps massive amounts of water.
Wow.
This provides an immediate, profound, volume-increasing effect that physically cushions the fragile tissue. It creates a durable hydrating barrier that far outlasts standard water or silicone-based lubricants, which, they tend to just wipe away or
Yeah.
evaporate.
But you constantly have to reapply those. Okay, so that 3D scaffold handles the mechanical friction right off the bat, giving immediate relief from the tearing.
Yes.
But what about that toxic chemical environment? You mentioned earlier the pH gets too alkaline, causing burning and infection.
This is where the specific formulation of these ovules is quite brilliant. As the PN-based ovules slowly dissolve in the canal, they interact with local enzymes in the tissue called esterases.
Wait, what are esterases? Are they just local enzymes acting like, I don't know, chemical scissors?
That's a perfect way to describe them. These chemical scissors interact with the formulation and trigger the release of lactic acid,
Lactic acid, okay.
which is crucial because that lactic acid forcibly drives the elevated alkaline vaginal pH back down to its physiological sweet spot, which is a slightly acidic 4.0 to 4.5.
Oh, I see. And that acidity is the exact environment the body needs to keep pathogenic bad bacteria away.
Exactly. It actively resets the microbiome's protective environment. Plus, these formulations are often combined with hyaluronic acid, or HA, and glycerin.
And HA is super hydrating, right?
HA is famous for its massive hydrating power, yes.
Hmm.
And glycerin acts as an immediate emollient. So within a very short window, you have this soothing effect that rapidly drops the symptom scores for that intense, maddening itching and burning associated with atrophy.
So the initial phase is too...
And as they are cut, they progressively release small nitrogen precursors, nucleotides, and nitrogen bases deep into the surrounding tissue.
But wait, doesn't chopping up the DNA ruin the medicine before it can even work? I'd imagine you want the chains intact.
That's intuitive, but no, it actually activates the medicine. The body needs those fragments. Once those precursors are released, they do two highly specific things. First, they bind to specific receptors on the surface of the local cells called adenosine A2A receptors.
Adenosine A2A receptors.
Right. And when they lock into these receptors, it sends a powerful overriding signal to the cell to downregulate inflammation.
So binding to the A2A receptor is basically like hitting the mute button on the body's inflammatory alarm system.
That's exactly what it does. It actively silences the angry, chronically inflamed tissue.
Wow.
And once the inflammation is muted, the second phase begins. Those raw fragments enter the cellular salvage pathway.
Okay, let's unpack this. In biology, a salvage pathway is about recycling, right? So instead of the body having to expend a massive amount of energy to manufacture new genetic building blocks from scratch, which is incredibly difficult for aging or estrogen-depleted tissue, the PNs are essentially dropping off pre-cut lumber and bricks right at the construction site.
You've hit the nail on the head. Manufacturing nucleotides from scratch requires a huge metabolic budget. By passively replenishing this local pool of recycled metabolites, the PNs effectively awaken the local fibroblasts without draining the cell's energy.
And the fibroblasts are the main characters when it comes to tissue repair.
They are. They are the cellular factories responsible for maintaining the structural integrity of our connective tissue. In atrophied tissue, because of the lack of estrogen, these fibroblasts are essentially dormant or sluggish.
They'll sleep on the job.
Exactly. But once they're supercharged by this massive free delivery of PN building blocks, they wake up and ramp up production. They start furiously building new collagen, new elastin fibers, and new extracellular matrix components like glycosaminoglycans.
Glycosaminoglycans. That's a mouthful. What do those do in plain English?
Think of them as the water-retaining mortar between your cellular bursts. They keep the tissue plump and hydrated from the inside out.
Oh, I see. So the fibroblasts are literally rebuilding the sponge.
They are structurally transforming that fragile, thin, paper-like mucosa back into thick, resilient, elastic tissue.
So we have this elegant molecular theory. The biochemistry makes total sense. But does this actually translate to women experiencing less pain when they go about their lives?
The clinical data strongly supports that it does. There is an excellent real-world study that looked at exactly this. It tracked 54 women suffering from severe vulvovaginal atrophy and dyspareunia.
Okay, 54 women.
Yeah. And they used a PN-based vaginal ovule, just one per day, for 2 to 4 weeks.
And to measure the results, the investigators used a validated tool called the Vaginal Health Index, or VHI, which it looks at elasticity, secretions, pH, epithelial integrity, and moisture.
Right. To give you context, a total VHI score below 15 out of 25 indicates severe atrophy. Before the treatment, these women were firmly in the category of severe atrophy. They were suffering profoundly.
So what does this all mean? What happened after the 2 to 4 weeks of using these PN ovules? Did the numbers actually move?
The investigator-assessed results were remarkable. They saw massive improvements across the board. We were talking about roughly 50 to 60% increases in measurable vaginal hydration, natural secretions, and deeper tissue elasticity.
That's huge. And what about the superficial petechiae, those painful, bleeding microtears?
Those improved by over 50% as well. The tissue was significantly thickened, the natural folds or rugae were restored, and it was no longer tearing and bleeding upon contact.
Wow.
By returning the natural stretch to the introitus, the mechanical friction that causes dyspareunia was drastically reduced.
Those clinical numbers are great, but the human impact is what really caught my eye in the data. The most staggering number to me wasn't a percentage. It was the fact that out of 28 women in the study who started with severe vaginal dryness, 27 of them were completely relieved of it after just a few weeks.
Oh.
Only one single woman still suffered from it.
It is a profound shift in quality of life. And if we connect this to the bigger picture, we have to look beyond just the cellular tissue. We have to look at the biopsychosocial impact of this kind of healing.
Because if you've ever experienced this kind of pain, chronic pain fundamentally rewires your nervous system.
It does. When intimacy consistently results in sharp, tearing pain, the brain learns to protect the body. This often leads to reflexive pelvic floor muscle guarding. The muscles subconsciously clench in anticipation of the pain. This structurally narrows the introitus even further, making the friction and tearing even worse. It becomes a vicious, self-fulfilling cycle of pain and tension.
But by treating the root cause, I mean by rebuilding the structural integrity of the tissue so it can stretch without tearing, you can break that loop.
Exactly. You aren't just numbing a symptom. You allow the nervous system to feel safe again. You restore the capacity for intimacy without fear, which significantly reduces that protective pelvic floor hypertonicity over time.
So let's take a step back and summarize the journey we've been on today.
Sure.
For anyone dealing with entry pain, or if you're just fascinated by where regenerative medical science is heading, we've seen how a drop in systemic estrogen mechanically degrades the vaginal introitus. It strips away the armor, flattens the shock absorbers, and turns resilient tissue into fragile, infection-prone tissue.
Yeah, that complete collapse.
And we've seen how highly purified salmon trout DNA offers a completely non-hormonal biocompatible solution. It acts as a prolonged 3D hydration matrix for immediate relief and pH balance, while simultaneously feeding dormant fibroblasts the exact pre-cut molecular building blocks they need to rebuild natural elasticity from the inside out.
It really represents a massive paradigm shift in how we approach women's health and tissue regeneration. And I want to leave you with a final lingering thought to mull over.
Go for it.
If we step back and look at the bigger picture, it is profoundly humbling. The fact that raw DNA fragments from a completely different species, a marine fish living in freezing waters, can perfectly interface with human adenosine A2A receptors.
It's crazy to think about.
It really is. The fact that they can seamlessly slide into our own cellular salvage pathways to heal our most intimate, fragile tissues. It speaks to a deeply ancient, universal language of biology. It reminds us that at the foundational level of nucleotides, the building blocks of life are entirely shared across the natural world.
We really are all built from the exact same blueprint. What a perfect note to end on. Remember, that diagnostic X-ray machine might seem broken when it comes to intimate pain, but as we've seen today, the science of healing is getting sharper, clearer, and more innovative every single day. Keep questioning, keep exploring the incredible regenerative capabilities of the human body, and we'll see you on the next deep dive.